Hi, my name is Kate, and I'm going to be doing a subcutaneous and intramuscular injection. I am wearing my gloves. I have 2 alcohol prep pads here. I have my little test injection stuff. I have a 21 gauge needle for the intramuscular and a 25 gauge needle for the subcutaneous. I have my filler needle on my 3 ml syringe, and my test subject here is a piece of bread. Alrighty, I have donned my gloves. The first thing I'm going to do is use an alcohol prep pad over top of our medication. Going to open my filler needle, but first, before I do that, we're going to cut that. I'm going to draw down to 1 ml. Now I'm going to take off the cap and dart it into our medication and press all of the air into it. Now I'm going to flip over and invert our medication and draw up to 1 ml, flicking away any air. I'm actually going to go a little past. Alrighty, and now I'm at 1 ml. So we're going to flip it over and, using a scooping technique, scoop it and recap. Now I'm going to pull off my filler needle, and the first one I'm gonna do is my subcutaneous. So I'm gonna take my 25 gauge needle out of my packaging and twist it on to this. Alrighty, so I'm going to uncap and pull aside. It's kind of hard to do. I'm sorry. Okay. And I'm going to go in at a 45-degree angle and insert the medication. And then I'm going to pull it out. Now, normally at this point, I would put it into a sharps container, but I'm going to do the scoop technique. That way I can reuse this needle for practice. Okay. And now we're going to do the IM, the intramuscular. So we're going to put this filler back on, and we're going to draw up to 1 ml again with the air, and uncap and use the darting motion to go into the medication, introduce that air, invert the medication, and draw up the medication. Tap away any bubbles. Alrighty, and I am at the 1 ml. We're going to invert this again. I'm using the scooping technique again to recap. Twist this off. And now we're going to open up our 21 gauge needle for our intramuscular. And we're going to twist this on and uncap. Now we're going to go right down at 90 degrees in a darting motion and inject the medication. Now, the same thing, I would normally then dispose of this in a sharps container, but I'm going to use a scooping technique here to recap for further practice. And at this point, I would label the medication. If it was more than a single dose, I would not rub the medication in for this patient. I would dispose of every of the wrappers, and then I would take off my gloves into a receptacle waste and use hand sanitizer.